So here, central venous line insertion is ready to begin. Place the patient's spine on the OT table with your arms to the side. Now position the bed at 10 degree, and this will decrease the risk of air embolism by engorging the subclavian vein. Just turn the patient head so the chin points 45 degree toward the contralateral side away from the puncture site. So that's swipe to select an EKG monitor basically, and leads. That's it. Now swipe to select a small rolled towel like this. Swipe to select a chlorhexidine scrub. That's it. And then remove the iPads. And wait. Drape the field using the drape technique. Just like this. And now unclamp the lumen of the central line. Like this. Clamp the lumen of the center line. And repeat this process for the other two lumens also. Here, here. Okay. And remove the syringe. Swipe to select the guide wire. And wait. So here is your guide wire. And place the catheter and guide wire to the side in the sterile field. Okay. And select the syringe with the local anesthetic. And that's it. Infiltrate the skin with 1 ml of the lidocaine just lateral to the posterior band of the clavicle. Just like this. So the skin has been infiltrated and it is ready for the central venous line insertion. Swipe to select the insertion needle with attached syringe. Just like this. And now like this. And you are clearly seeing. Stop the needle when it reaches the inferior to the clavicle. When the subclavian vein is accessed, venous blood will flow into the syringe. Don't advance more than several centimeters to avoid deep neck structures. So swipe to remove the syringe and immediately place your thumb over the needle connector. Like this. And you are seeing blood is oozing out. And insert the guide wire into the needle and progress carefully into the subclavian vein. And stop the insertion of the guide wire when EKG monitor shows an arrhythmia. Arrhythmia indicates that the guide wire has reached to the heart. And that's it. And now you will use a scalpel to make a small incision in the skin next to the entry point of the guide wire to facilitate placement of the dilator. And just like this, and remove the scalpel. Then this is the dilator. Put the dilator over the guide wire and then remove the dilator. And select a piece of gauze. Just like this. If there is excessive bleeding, then place the gauze over the guide wire entry site and hold pressure to control the bleeding. And central line catheter. Place the catheter over the guide wire and begin to insert catheter using a rotating motion, just like this, and ensure control of the guide wire, like this, and slide the guide wire slightly out of the skin to aid manual control of the guide wire while advancing the catheter. And you are clearly seeing this thing. And you will unclamp, and after that blood is coming, and syringe to flush all the pores of the catheter. Just like this. Remove the syringe now. And finally, uh, you will just fix it to keep it in place. And just wait. for some time. And just we are at the towards the end of our procedure now, and our network is to some out slow. Well, and you will remove the drape and auscultate breath sounds and observe respiratory rate to ascertain there is no large pneumothorax, and obtain the chest x-ray to check the line placement and to confirm no hemothorax or the pneumothorax has occurred. And this is the x-ray finally. And so thank you so much.